Hi, state employees and retirees. I am here with Chuck Stone, our Scenic Director of Operations, but more importantly, our guru on all things health plan related. Chuck has been our state health plan expert for years, and he's here with the whole story about what's been put out there in the last couple of days on state health plan. So, Chuck, in a nutshell, what's been proposed?
Okay. Ardis, what's been proposed is some significant changes to the health plan design, and there are some reasons behind that, which we should discuss. But basically, the one that members are most concerned about, for the first time, it will impose a premium on the PPO 70/30.
So no free option anymore.
There will no longer be a free premium-free option in the state health plan. Everyone, I need to correct that. Most people will have to pay a premium. I heard a lot of comments and need to emphasize, no Medicare retiree will have to pay a premium, even if they take traditional Medicare. Early retirees who elect the PPO 70/30 also will not have to pay a premium. If a pre-Medicare retiree takes the 80/20, then they would have to pay a premium.
So there's been thought given to the situation for retirees with regard to this
Correct.
premium.
And that is part of the good news, that the state for once is recognizing the fact that they made a promise to state employees that when you retire, you will have free health insurance. Now, we prefer that be the 80/20 as a supplement to Medicare, but at least in part, they're honoring that commitment to offer a premium-free option to retirees.
So what will the premiums be?
The premiums right now as proposed will be $25 for the PPO 70/30. It will be $50 for the PPO 80/20. If a person uses tobacco products and is not willing to enroll in tobacco cessation, that will add $60 to their premium costs. But that was already built in to the alternate structure anyway.
So last year when we did one of these videos, we were facing the complete loss of the 80/20 plan. Premium, no premium, it just wasn't going to be there.
Correct.
And we fought that off. And we fought off the state health plan taking away employee and spouse coverage, which had been talked about as a possibility. So we kept the 80/20 plan, and what we're hearing now is that in order to keep that 80/20 plan going forward and to keep everything on good financial footing, we're looking at $50 for the 80/20, $25 for the 70/30, unless you're a retiree of different sorts. What does that mean, however, in terms of the surcharges that might give you credits towards those premiums?
Let's talk about, for a minute, what the Treasurer has expressed concerns about with regard to the old plan design model.
Okay.
Under the old model, there were several problems. The open enrollment process was very complicated.
We got the phone calls.
Every year, my phone blows up and I'll, Chuck, I did the health risk assessment. I did the tobacco attestation. I designated a primary care physician, and they say that I didn't do it. Well, if you go in, I failed to click down here.
It was a gotcha game.
Yes.
It was catching a bunch of people.
The enrollment process was a gotcha game, and we got calls from people that were getting hit when they had done everything they possibly could or couldn't get through on the phone lines, paying $1,080 per year in premiums because they didn't get the premiums credits that they were due.
Right.
And this is unfair to people. The system, you should not have a system where people have to jump through hoops. So this is going to get the open enrollment process, simplify that open enrollment process. That is a big win. And the only thing people have to do now really is the tobacco attestation. I would still encourage them to designate a primary care physician. Mm-hmm. The reason being, now they will get when they go to that primary care physician, they will have a lower copay
Okay.
and therefore save out-of-pocket expenses.
Oh, agreed. I mean, that would be a far preferable thing.
Yes.
But in short, it's $50 for the 80/20, $25 for the 70/30, and there's no way to get credits back if you jump through these hoops that a lot of people were getting caught in. It just is what it is. Now, what does that mean for the rest of the plan? We've seen every year, deductibles keep increasing on us. Specialty visits would increase, and people were really they were very nervous because year to year it would just catch them and things would go sky high if you needed health care.
And Ardis, that's the valid point. The options presented yesterday were basically two options. Either you pay a premium for the PPO 70/30 and the 80/20, or we could continue down the same path that we've done for the past 6 years. In the past 6 years, and even prior to that, every year, premiums would go up X percent. That might be 3.8, might be 4.5%. So there was no certainty about what your premium would be next year. Second thing that was happening, and it got extremely difficult, if not impossible, for virtually any plan member to know what their benefits were, because benefits were changing every year. They were increasing deductibles, they were increasing the copays, they were increasing out-of-pocket expenses. Then this year we found out that there were people on prescription drugs that, if given a certain unique set of circumstances where you needed specialty generic drugs, you might be better off in the PPO 70/30 than you were in the 80/20. And I had one lady that she said, Chuck, normally I would follow the recommendation to take the best health insurance you can afford and buy the 80/20. But my son needs a specialty generic drug. And when I looked at the 70/30, because of the way they manipulated the plan benefits, it actually became the better option.
Yeah, that's
for
the
her.
First time something like that has happened.
So this plan redesign is, as the treasurer said, he wants to get to a neutral provision where members aren't being sort of shoved toward one plan or the other. And the plan in recent years had made the CDHP, Consumer Directed Health Plan, had manipulated the design to try to encourage...
That's the high deductible plan.
Yeah, high deductible. They had manipulated the design to try to force people to enroll in that. And there were individuals, and are individuals, who would benefit from having that option. That option was eliminated. I suspect in the future it may be resurrected, and certainly think it ought to be an option for some of our members. But at the same time, it needs to be redesigned with a health savings account, not a health reserve account.
What we were hearing in phone calls, and I think this is something you brought up yesterday in your comments, is that the CDHP would have been a good plan for more people, but I think only 7% of the people in the plan took it because it was so much money up front with this high deductible. And so really the people who could enjoy it were the people who were the higher paid employees, and it cost the health plan a lot of money, which of course in turn cost everybody in the health plan money.
They started out with about 3% enrollment. It had grown to 6% as of yesterday when they made their announcement. And again, you need a high degree of health literacy in order to take advantage of the consumer-directed health
So if
plan.
you're a state employee, and we have so many people working 2 jobs, you really don't have time to try to solve a Rubik's Cube to figure out what your health plan is going to be.
That is correct.
And it sounds like the one good thing in all of this is that you will have a premium. You're not going to see your costs go up in terms of your deductible, your copays, things like that. That's all going to stay static. It's going to be the same.
Yes.
For how long?
That's the good news. That is something that
We'll take the good news.
The average state health plan member has no knowledge of this yet. Hasn't been reported in the media, but basically, the plan design as it is right now in 2017, your benefit structure is going to remain the same for 4 years to 2021. The premiums you pay for family coverage, for child only, for your spousal coverage are going to remain the same for 4 years. So there, as with most changes in anything you do, there are winners and losers. But anyone with dependent coverage is basically going to come out a winner under this new design.
Well, is a healthcare, you've taught me a lot, and you've taught me healthcare generally, the trend is that it's going up somewhere about 12 to 14% a year, something like that?
That has been the average in recent years after the Affordable Care Act, despite all the negative comments about Obamacare. Premiums had actually moderated. Healthcare costs were increasing roughly 8.5% per year on average. Now in the news media and on television, you read about those exceptions where it was 35 or 50%.
So let's say it's 8% a year. Healthcare costs on average are going up 8% a year, but healthcare costs for state employees, from what you're telling me, for the next 4 years, instead of going up 32% over 4 years, will go up 0% over 4 years.
Correct, and we will maintain our benefits, and that's a big win.
That is, as you said, you know, no one's reporting on that, and it's almost beyond me. So just to recap, just that part, there would be a premium which is against Scenic's policy platform. We have a policy platform objective that says we are against premium increases. We're against a premium at all. We want a premium-free option in the state health plan. But what people, you know, sometimes you pass these policy platform objectives without thinking about, well, what if there's an option on the table that says, hey, your costs would be held firm for 4 years? And we've kind of discovered in recent days, because you had an idea to ask the members, what do you think? And can you tell us about when we asked the members what they think?
We did put out an email to those we have on our listing, and I really expected the response would still be, you know, no premium.
Yeah.
Interestingly enough, 2 out of 3 respondents said that they wanted the certainty of knowing what their benefits would be. They wanted the certainty of knowing that their premiums would be locked in for that 4 years. And so I was totally surprised and blown away by that result.
I think, you know, state employees, contrary to what politicians, the media, and a lot of people like to say about them, our experience of our members has been that if you give them information, you know, they use that information. And I think that's been the problem here. There's not been information put out there in the media on this that tells the whole story that we're trying to tell right now.
And what we know is, yes, you're giving us 2 options. Here's 2 medicines, and they both taste bitter.
Yeah.
You know, I don't like the taste of it.
Right.
But at the same time, the other part of the story is not being told. And no, I don't like the premiums. My concern about premiums all along has been that if you start down that road, does the General Assembly or someone then use that as a means solely to keep shifting costs to plan members? That was occurring, but in a different manner. And so in view of trying to, what the Treasurer is trying to do to lock in rates, to give certainty to families as to what their premiums are going to be and their benefits are going to be, and to make it possible for people who need dependent coverage to have that, actually should help bring down cost in the long run. Reason being, you improve the mixture of people in the plan, and we don't get just the sickest dependents, we get healthy dependents.
We need those kids.
That's right.
We need the kids.
We need the kids, and that who are generally going to be healthy, have lower health plan costs, and are going to bring the cost of everyone in the plan down.
Okay, so this treasurer's been in office less than 3 months. And here he is, Treasurer Falwell, having to come forward with this plan. You know, a lot of people are asking me, hey, did Scenic back the wrong guy?
Let me respond to that, Ardis. Since Treasurer Falwell came into office, number one, he has been over and spoken to several of our Scenic committees about the state health plan and the state pension and the problems he's identified over there. He has been on the phone to vendors on the pension system arguing to bring costs down and some of these hedge fund and alternative investments that have cost us as state retirees a lot of money.
There's a new sheriff in town on that stuff.
Yes. He, for the first time in a state health plan meeting yesterday, the treasurer brought up something we have been mentioning for 6 years. That is the 216% of Medicare reimbursement rates that the plan pays for outpatient hospital care. And the national average is about 140%. So in effect, we're paying more than 50% above the national average, and the treasurer made reference to that yesterday, and he wants to go in, get down to why this has been happening, and that would save anywhere from $250 to $350 million a year. Where's that money been coming from? It's been coming out of the pockets of state employees.
I think you called it yesterday death by 1,000 cuts, where premiums have been increasing. Maybe it hasn't been a dramatic increase. Premiums have been increasing while deductibles have been increasing, while copays have been increasing, while specialty drugs or specialty visits have been increasing. So it has been sort of a death by 1,000 cuts where you couldn't really tell what was happening to you so much.
Absolutely, Ardis. Would you rather me give you a single pill and say, look, this will help make you healthier? In the end, you've got the flu, but it's going to make you healthier. Or you want me to sit here with a razor blade and just gradually skin you alive?
Yeah, so I mean, I don't want you to skin me alive, just FYI. No, I think that what you just told us about what Treasurer Falwell intends to do is the other question I'm getting asked a lot, which is, why increase our premiums? Is there nothing else we can do? And there is something else, and he's working on that, is what he told us yesterday. But this problem wasn't created overnight.
The treasurer inherited this problem, and it's to say it's not something that happened overnight. It didn't happen in a single year. It's been going back for over 6 years now. Mm-hmm. And as a result, it has been compounded. Mm-hmm. We've overpaid $1.5 billion in premiums during that 6-year period. Or not premiums, $1.5 billion in hospital charges. And, you know, plan members have suffered as a result. And to fix it, he's temporarily got to stabilize the plan. Made a proposal yesterday, and I hope this will be true. When the Unemployment Insurance Trust Fund was broke and the state redesigned that, they said, okay, the employer tax will revert to normal once we pay off the debt. Same thing, I brought that up yesterday, and I noticed that got a reaction from the treasurer and several board members.
You got his attention.
If we've got to pay a premium surcharge on the 70/30, make it time limited. When we get the plan stabilized, we've identified the savings, then maybe we can remove this premium on the 70/30.
So you have to get the money for the health plan from somewhere. There is money that the General Assembly will appropriate towards the health plan. They do every biennium, and the governor put 4% in his budget towards the health plan, and my understanding is that will probably be well received by the legislature. They'll do the same thing. That still leaves money that has to come from somewhere. This proposal has the premium increase for state employees and retirees, or some retirees, I guess very few state employees, and we've talked about how he's going to look for providers to share in that sacrifice, but you can't do that overnight. That only leaves the General Assembly as a place for the rest of the money. And if they were to put more in than the governor put in his budget, and then that they're probably
there
going to
go your pay raises.
It'd be your pay raise or your COLA.
There go any COLAs for retirees or bonuses for retirees. And so, Ardis, this ties into something you and I have talked about that government relations has been working on. your staff have been working on trying to get a flat dollar increase for all state employees.
Absolutely.
$2,400 a year is the request. And as I pointed out yesterday, if every plan member is going to have to pay this $300, it doesn't matter if they are a building custodian, it doesn't matter if they're a correction officer, it doesn't matter if they're an administrator, college professor, whatever department we work in. And I would think NCAE would support this, because Mark Jewell made reference to teacher assistant making $20,000 a year. Our proposal is every state employee, every teacher assistant, all of our DOT workers, correction officers, everyone get this flat $2,400 a year, because everyone needs that money to pay for this premium. This is a win for all
Everybody
of us.
has to share in the sacrifice of an increased premium. If you do the math, the increase in this premium over the course of a year would in fact be about $420, right?
If you take the 70-30, $360, and,
Right,
and
for
if you
80-20.
take the 80-20, $600. And-
No, the increase in the premium.
Oh, I'm sorry. Good point. Yes, but let's explain one other thing, Ardis. Originally, in the 80-20 right now, you pay $15 a month
right.
in round figures. It was already going to go
Oh, that's right.
to $25
It was already
a
gonna
month
go up, yeah.
with the benefit cuts and the increases in co-pays that they had proposed to do that. The 70-30 would have still remained premium free, but they were going to cut the benefits. So you were going to pay extra money for the 70-30.
Yeah.
You're going to pay extra money for the 80-20. So the true increase is not just from the $15. That was already a done deal that there were going to be increases. The only difference is that what was proposed yesterday, instead of being the 25 on the 80-20, is $50.
But with none of those increases in cost when I go to the doctor.
Correct.
Okay.
Correct.
So if you're talking about a $25 increase a month compared to what we expected over the course of a year, do the math for me. 50 times, that'd be $300 more a year for the 80-20, right?
Yes,
Okay.
$300
Than what we
more
expected.
than what we expected.
If we could get a $2,400 across the board base pay increase for state employees, all state employees, they would still make at least $2,000, $2,100 after the increase in their health care. And that might change some lives, particularly from anybody all the way up to the median pay grade.
Absolutely, Ardis. And you know, my daughter's a school teacher. I have heard teachers say for years, look, we've got a pay plan, it's being funded, and we appreciate that, and we really need it. And at the same time, our teacher assistants, our school custodians, the people we work with, even the bus drivers. And I've heard supervisors and managers in state government say the same thing, that not say every year has to be a flat dollar amount, but they have said, we realize they're hurting too. We want to do the same. We want them to get the same amount, and let's bring the dollars in, because they are going to have to pay the same amount for these health care expenses that we pay.
Yeah.
So that needs to be a flat dollar amount.
So to summarize, I mean, I think that the premium, there will be a premium on state health plan, period, no matter which one you
Yes.
take, unless you're a certain type of retiree. And the premium will go up dramatically from what it is now. You won't see any other cost increases other than premium, according to this proposal that passed the board yesterday. And it is our understanding that for 4 years after this, it is the treasurer's intention, and he has stated that, and we know him well, he doesn't state anything without backing it up, that the premium would not increase for 4 years, and neither would any of the costs for you in terms of deductible and specialty visits and that kind of thing. That is the whole story. That's where we are right now. And you know, we welcome any of your feedback. We also encourage you to call legislators and support a $2,400 increase for everyone. We're all in this together, and it's time. It's time for state employees and for retirees. And don't forget, the most important thing I can think of right now for you to do would be to attend Lobby Day on March 29th. State employees and retirees are coming together to come down to Raleigh to the General Assembly. We're going to be there at 10 o'clock and stay there the rest of the day. Lobby Day is your chance to talk to lawmakers. We'll take you around. We'll have talking points for you so that if you're wondering, what do I need to talk about? We've got those for you. If you can't come to Lobby Day, send an email or call your legislator. They honestly do care. No matter what you think, they care. And they want to hear from you.
And Ardis, let's ask them to bring their children, their grandchildren, and their spouses also. And
don't take the kids out of school, though. It's important. But thank you for listening, and I hope this told you something about the health plan that you didn't know before.